Well, as a judge, I look for three core things. So the first for me is clarity. So is there a problem that is clearly defined? Is it obvious why that work that has been entered matters, especially for patients and for services as well? So that's the first thing I look for. Then I look for the evidence of the patient or the service user centeredness. So is the patient, is the service user's voice genuinely embedded all through the project, not just an add-on, something that looks as if it sits at the peripheral. So is it core to the work? Does it demonstrate there's been evidence of meaningful involvement and engagement? So that's central to the work of PEN. And then is there a demonstrable impact? So can I clearly see what has changed or what has become a practice as a result of the work? Is there evidence? So not just describing something that has improved. Is there evidence of what has actually resulted as a result of that work? So for me, it's finding a way of clarifying your entry. It's clear, credible, and evidence of change. So there is a problem, there is an intervention, and there is impact. So that's how I try to look for um, evidence of impact when I'm reviewing entries that have been submitted for the PEN Awards. Yeah, this is really important, isn't it? Because you want to make your submission stand out. So it's important to be clear and concise. So for me, is ensuring that you're using plain language. So often judges have so many entries to read in a short period of time. So the easier you make it, the easier it is for judges to follow the narrative of what it is you've submitted. So for me, I wanted to clearly start at what was the problem, what was the issue, what was the innovation, what was the idea, what were we trying to address? So it's important to define that at the word goal, because you're then creating an opportunity to hold for your reader to now hold on to that thread of how you're going to tell them the rest of what that problem, of what the issue was. Why did it matter? Why did it matter to patient experience? Why did it matter to patient outcomes or to equity or to safety or to how we train future health and social care professionals? So define the problem or define your issue or define the solution that you were trying to bring some innovation to by involving patients. So that's the first step for me for a strong entry. Then the second one is to understand the context. So what is this work about? Why is it important? Who was involved through the course of that project? Is it patient? Is it staff? Were there other partners, stakeholders involved? Were there researchers? Were they academic? Because the insight and that data is what has helped inform your work. So it's good to give us the context so that we understand the context to this problem that you've described. Then obviously you actually have then described the problem. You've given us some context. So what did you then do? So it would be good to then know what was implemented or what was changed and how did you approach that implementation and that change? Was it co-designed? Was it in partnership? So describing that intervention and the process of your implementation or the process of your change is also another step that is important. So define the problem, understand the context, and then describe the intervention. And next to that is how was it then delivered in practice? So how did you implement your intervention? Did you face challenges? So this is where I said it's good to include the honest aspects as well. If there were challenges along the way, what challenges did you face? What did you have to adapt along the way? And how was it then delivered in practice? So that's another one. And the key to all of this is the reason you want to implement something or change something is because you want to make a difference. And did you make a difference? What difference did you make? So demonstrating the impact, and ultimately, is this sustainable? Can this now be shared with others? Can it spread and become something that people take away and adopt in their practice? Can it be scaled? So those are the 6 steps for me: defining the problem, understanding the context, describe the intervention, what you implemented, what you changed, explain that implementation, and if there was any impact, tell us what the impact was. And if there has been opportunities where you've now had to share this practice and someone else has taken it and adopted it, it will be good to see that as well as part of the submission. So it gives us we don't often spend enough time to just stop, pause, and reflect on the type of work people do. Pen gives the platform to celebrate that. Certainly for me, until I entered into one of the categories, enter the submission, it was until then I actually stopped and paused. This is amazing. Like this initiative. Why am I not sharing it? Why am I not before Pen Awards? Why am I not sharing it to a whole lot of people and sharing this practice so people go away and glean something from it, and they go away and it hopefully inspires them to adopt some aspect of it into their work, or they reach out for collaboration, for support. And I think that's the beauty of Pen, isn't it? We have to continue to build the evidence base of the practices and the projects and the research, of how we embed the patient's voice, of how we involve and engage patient service users and carers into their care, or how we use their lived experience to train future health and social care professional is really important now. Pen gives a platform to something that I think is crucial to how we're going to achieve the NHS Fit for Future 10-year plan. All the efforts to move care from hospital to the community and to focus on prevention and not illness. We need to understand people who are on the receiving end, the impact that is having on them, because that's how we're going to get the design of services right. That's how we're going to get the implementation right, or where we've identified need for change. That's where we are going to. So it's really important that oftentimes it's not about big complex issues, projects, or problem. Is just one clear, honest approach to want to make things better for patients, for service users. And if we can use Pen Awards as an avenue to just demonstrate and showcase some of that evidence base, then hopefully we are contributing to championing the impactful work people are doing in terms of ensuring that people receive good quality care just by being creative in how we involve them and using their lived experience to drive change, or to drive innovation, or to drive implementation of things that makes it better for everyone else. I think that's why it's important for me.